you all think it is as people living, working, volunteering in the affected areas. I just want to mention a little bit of housekeeping. I'm not going to tell you where the toilets are. I'm not going to point to the emergency exits because I'm fairly sure you know where they are already. Our intention is to record today's session. So at some point fairly soon, we will press the record button. So we'll record the contents of today. I think there's going to be a lot of interest in what's said, and obviously not everybody will be able to make it on a Friday lunchtime. Not everybody can make it during half term. So we'll record the session and make it available on our website. So if anybody has not been able to make it today that you're aware of, then the links will be on our website for people to access the webinar later. We've also got the closed captions on, so hopefully you can see at the bottom of your screen a transcript of what I'm saying. We've found in webinars that we've done in the past, some people have found this helpful, some people have found it distracting. You can switch it off if you don't want to see the instant transcription of what's being said. So at the bottom of your screen, I think there should be a button which might say closed captioning, and if you live transcript, I think so you click on live transcript and you can the translation. We're going to have everybody's on mute as well. There will be opportunity for questions. So if you have questions to any of the speakers, then please pop them into the chat. My colleagues Charlotte and Millie will be monitoring the chat, and they'll make sure that questions get put to speakers probably towards the end of the session, but if there's something really important, we'll try and bring that up as soon as we can. So without further ado, it gives me great pleasure to welcome David Regan from the Director of Public Health. David, over to you.
Thanks, Stuart, and it's great to be joined by Atia, Kush and Charles on the call today. I know I've spoken to a few of you over the last few weeks about this issue, and it's great to see some friendly, familiar faces as well. What I'm going to do is just give you a very up-to-date overview of both what we call Area 1 for this operation, which is Moss Side, Hume, Fallowfield and Whalley Range, and Area 2, which refers now to Moston and Harper Hay. It'll just help me distinguish because they're at very different stages of development. So I'll start with Area 1, Moss Side, Hume, Whalley Range and Fallowfield. And for shorthand, I'll just refer to it as Area 1. So Public Health England were first notified of 4 cases of this particular variant on the 3rd of February. And the variant in question is a mutation of the UK Kent variant, which is now the dominant strain of COVID in this country. So this particular mutation, you'll often hear it referred to as E4A4K. So it's the UK Kent variant with this mutation. And what had been happening, people who test positive across the country, a random selection of samples of the tests are sent away for genomic sequencing. Obviously, particular concern was the South African variant, which you may have heard about in the press, and also more recently, this particular mutation, which actually first appeared in Bristol and South Gloucestershire. So there was a cluster of cases of this particular variant in Bristol and South Gloucestershire. And then through the genomic sequencing, they identified 4 cases in the Moss Side area, 2 separate households, and Public Health England were notified on the 3rd of February. Public Health England then undertook the initial contact tracing and enhanced contact tracing with everybody involved. And then we were notified to basically put in a submission to be part of a national, what's called Operation Eagle. Now I have to apologise, it's not the name we would have chosen, it's a national name for this, and we've fed up that these militaristic sounding names for these operations are not helpful. We recognise it's a national framework, but we have fed that back. But the operation involves community surge testing when you've got cases of a variant of concern identified in your area. And this mutation, E4A4K, was officially classified as a variant of concern. Surge testing had already commenced in the Bristol, South Gloucestershire area. So they were underway with their programme. And you'll have heard that the South African variant, surge testing was introduced in Southport, in Hertfordshire, in other parts of the country. So it was getting coverage, obviously, in the media, but often the media were getting confused with the different variants. So just to reiterate, the variant in Manchester, and it applies to Area 2, Moston and Harpay, is the E4A4K variant. However, we know, and it's happened in Southport, we know it is inevitable that we will hear of cases of the South African variant across the country over the coming weeks. But for now, we'll just focus on E4A4K and how it applies to Area 1 and Area 2. So, in terms of the surge testing approach, the initial framework recommended that you try and reach 10,000 people based on the number of cases. So we had 4 cases, and that you look at both the epicenter, where the cases have occurred in the area, and then basically fan out from that area, but be mindful of natural boundaries, natural communities, where there are breaks. So to give an example, the Aldi in Fallowfield in that area was included after discussions with local elected members and others. But you have to stop somewhere because it's just to look at that catchment. And what the purpose of the surge testing is, it's twofold really. One is to genuinely identify asymptomatic cases of COVID to help people to intervene early, to help them self-isolate, to help their contacts self-isolate, and to protect them and their families and reduce onward transmission. So just as with any testing, that is a core element. The other element is basically asking our communities to participate in helping us understand more about the virus and the variants and the mutations, so that we can help the scientists and others adapt the vaccines, plan ahead, and also learn more whether particular mutations are more transmissible. So the UK Kent variant is more transmissible than the original COVID we had back in spring of last year. So there are 2 elements to the surge testing. One, to help individuals, their families, around the basic testing process. The other is to encourage that community involvement in helping us find out more. So we set up mobile testing units very quickly from Tuesday, the 9th of February. We had them in Bedwell Street at the Islamic Cultural Centre, Gurdwara Temple on Monton Street, and the Our Lady's Roman Catholic Church on Raby Street. And we also, they were mobile testing units, they're outdoors, but we did have some indoor facilities for registration. We also set up a testing centre at Moss Side Leisure Centre. We'd already had some asymptomatic testing through the LFDs, local lateral flow device test, the 30-minute result test. But for any surge testing for variants, you need to do the PCR test, the tests that we normally do for people when they're symptomatic. But on this occasion, we need to do the PCR test because it's only PCR tests that we can use to do further laboratory tests for the variant. So we had 4 testing sites in Area 1, Moss Side Leisure Centre, as I say, converted into a PCR testing site, and we've been publicising that. Now, we've done comms engagement, we translated materials into 19 languages, but we also embarked on a door knocking exercise. So we split Area 1 into 6 zones, and teams, council, voluntary sector, and I know Charles and colleagues and others have been involved in promoting what we're trying to do, and our local councillors. And I think we've now reached about 90% of the houses in terms of that approach. We also had a home delivery service of kits for people who are clinically vulnerable, those that were shielding, those that were in receipt of social care, and our local care organisation dispatched nurses to go and either take tests in individuals' homes in some cases, or leave testing kits for collection later. So that programme has been underway. And we will continue. We stood down the Bedwell Street Centre earlier this week, and we'll be standing down Raby Street and the Temple after this weekend, because uptake has started to reduce from that initial response. But we are keeping Moss Side Leisure Centre open till next Friday, not least because it's indoors, it's properly spaced out, and particularly with obviously rain, wet, cold, it's a much better site, and it can continue, plenty of capacity there to continue offering the tests. So to date in Area 1, we've had about 3,000 test results completed, but we've also had a collect and drop service for local businesses, schools, and other facilities, and we're starting to see those come back now. So we expect our numbers to increase over this weekend in terms of what's coming in, and we'll keep, as I say, the testing sites, a few for this weekend, and then Moss Side Leisure Centre. We've had 57 positives so far, and all of those cases, they've been informed. We followed up on contacts, and we've had local control of this process. So the actual contact tracing team for the city are based in Moss Side Health Centre. They've been taking on this responsibility. We've not gone through NHS Test and Trace. They've had a minor role, but they've given us the delegated authority to follow this up. The 57 tests that we've had back, they are now all at the Alderley lab for genomic sequencing. Now, because there are so many tests going in there, we have told people it will be 10 days to 2 weeks before we get those results back. That's all been explained to people in their call, and we will be going back to tell people whether they have this variant, the mutation, or not. So we've given that commitment, and that will, as I say, we'll start to get those results in next week. So moving on then to Area 2, Moston Harper Hay. So Public Health England were informed of a single case in this area, so just one case on the 10th of Feb. They did their initial assessment. There was no epidemiological links to the Moss Side cases or to Bristol Gloucester cases. So therefore, because there was no obvious links, we were asked to again introduce the surge testing approach. But because it was only one case, we didn't need to do 10,000. So based on the discussions with Public Health England, we went for a reach of just over 5,000 across households in a chunk of Moston ward and a small chunk of the Harper Hay ward. So we used the same principles, informing local members, speaking to the registered housing providers, and obviously getting the comms out as quickly as we could. We can only issue the comms once government tells us we're part of the operation. So, you know, our hands are literally tied, but as soon as we got that go ahead, which it came on a Monday evening about 9 o'clock for Area 1, and it was similar last week on a Tuesday evening for Area 2. But we were able to then quickly mobilise. We had a mobile testing unit in place for Moston on Ebsworth Street on Wednesday morning. And the first day of that testing site, we had over 515 people come through. We haven't had the results from yesterday yet, Thursday, but today we've got our second mobile testing unit in the south of the zone on Thorpe Street, which went live about 10 o'clock this morning. So we'll be trying to reach as many people as we can over the next week or so. Door knocking starts in that area today, split into 5 zones with council teams, VCSE colleagues and others doing that. And we've only had one positive case so far from Wednesday's tests but we will obviously, it's early days, and we'll find out more. And there has to be an endpoint, obviously, an exit strategy. So for Moss Side, Hume, Fallowfield, it will be next Friday, the 26th, will be the last day of testing in that area. We'll make a decision on area 2 over the next few days, but it'll certainly continue into next week, throughout all of next week. We're trying to just get as many people to come forward as we can, just to check on the spread of this particular variant and learn more about it, because you'll already be aware the South African variant, the concern is the vaccines may not be as effective. So really trying to make sure we're ahead of these mutations, and we can look at adapting the vaccine as we go. So happy to stop there, Stuart, and I think colleagues are going to speak, and then there's a Q&A session, as I understand.
Yep, absolutely right. Thank you very much, David. That's a fantastic overview of the two areas and what's been going on, and reassuring to hear we've had such a great uptake in Moss Side and area already. That's fantastic news, and credit to the residents and the people in that area and the organisations that have been mobilising their members and the population to get out there. And I guess, talking of which, I'd like to now start to introduce some of our co-hosts and co-sponsors in this event to talk about kind of the work they've been doing. And so, Atia, if you'd like to start off about the Manchester BME Network.
Thank you, Stuart, and thank you, David, for that. And thank you to Public Health in Manchester for all the work that they do and have done at pace, which helps us all and keeps us safe and saves our lives, basically. Can I just say that I'm an associate, for those of you who might not know, with the Manchester BME Network, but and some of you may know I'm also a lay member for Manchester Healthcare Commissioning Board and lead on public and patient work. And I will say right at the start that I may use acronyms like BME and BAME, and I do understand that there is a language discussion on this at the moment nationally, and that we understand that, and we are looking at how better to use language right across the system. I just want to quickly give you some bullet points really on some of the work that the Manchester BME Network has been doing, and the Greater Manchester BME Network, which I also chair. So a great deal has happened literally since last March, since the pandemic started, and coupled with Black Lives Matters, there's been extensive work at a local level and at a national level, which we've jumped on and been part of, engaging in discussions at a national level as well as local level, and looking at what is happening and talking at all those levels about the needs of our communities and ensuring that our representation and our voice and our needs are heard across the board. So generally, that's what we've been doing. On a practical level, because we're a very practical frontline kind of network, doing lots of work at communities level. So last July, we jointly with Greater Manchester BME Network and GMCVO, which is the Greater Manchester Centre for Voluntary Organisations, were successful in securing funding from Comic Relief and National Emergency Trust, which was emergency funding as a response to COVID and relief work for our communities. And we were very fortunate and to get over £300,000 to give out in grants, which we have been doing, and some of you around this may be beneficiaries of that. And that was really very much emergency COVID relief for our sector, in recognition of the disproportionate impact on our sector and on our communities. And I can tell you that a very significant number of those grants have gone to food relief work, ethnic food relief work, and for devices for education and learning and engagement for people, for children in terms of education, and for the community in terms of that digital exclusion. So lots of fantastic projects have come in, and they still are. and the deadline for the final round of funding for that is still available and closes on the 26th of February. So if anybody still wants to apply, you can do, please do. And we will try and accommodate as many organisations as we can with the remaining funding that we have. That has led us to really look at the issue around food and food poverty and poverty generally that I see increasing in our communities, who are disproportionately impacted due to the inequalities that exist in the system and the inequalities that have increased due to the situation that we're in. And we are anxious and worried that, you know, post-April, when furlough finishes, that we are going to see more disproportionate impact on our communities as people start realizing what their job situations might be. And so in response to that, we have gone into partnership with FareShare with funding for a pilot we have received from the GM Mayor to develop our understanding and our reach on the food response across Greater Manchester. So we have set up the Rafiki Food Project, which is specifically responding to the ethnic minority needs and the ethnic food needs that are right across the system. We have been distributing through FareShare something like 1.5 to 2 tons of food every week to a number of organisations through that system. So if anybody's interested, I think Fiona's put our link and our contact in the box. Please get in touch with us and we will try and help people we can. On a more strategic level, we are members of what's called CAHN, which is the COVID Health Equity Group. And that was set up at pace by Public Health towards autumn last year to look at the equity issues that I have just been mentioning. So we do sit on that, as does Charles, and Breakthrough, to try and work with people in public health to support that system, to reach our communities, to influence the work that's happening, and to help the work that's happening in terms of communications and engagement, so that we can reach our communities at pace to save lives and keep them out of hospitals and getting into serious situations, and so that they understand the restrictions and the guidelines which have been coming out and changing constantly, and help with that. So that's been happening. We, through that, a number of sounding boards were set up. We host one of those sounding boards, which was, when it was set up, was called the Pakistani Sounding Board. Some of you around here are members of that. And it was called the Pakistani Sounding Board because at the time it was set up, we had very, very high infection rates in that community. And it was really important to immediately respond to that at pace. And that's what was set up. So that has a membership of organizations that work on the front line and reach those communities right across the neighborhoods. Along with that, a small fund was put aside through Public Health to fund with small grants organizations that could, again at pace, look at messaging in different languages, in different ways, to reach those communities as quickly as possible. So that work is underway, and some really good things are happening on that, and some really good videos have been done, and they're distributed right across the system to help with everything else that's already there. That group is now actually renamed as the South Asian Sounding Board, as we're starting to see more data in terms of the impact across other South Asian communities. And that work is ongoing and continuing. We have with that also a WhatsApp group, which pretty much works 24/7, and people have the opportunity to post on there as they see messaging and communications coming, both positive things that can be shared with others at pace, but also alerting people to some of those messages that are anti-vaccination messages or wrong fake news, and all of those sorts of things that are also out there in the social media that we need to be aware of and respond to. So we're doing all of that kind of work. We held a meeting around this issue of the surge, and at that point We knew about the Moss side surge, so we again supported the system, held a meeting, had over 60 organisations at that meeting last week, was really very good, and public health consultant Cordell came to that meeting and spoke and shared that, and it was excellent to do that. And we are planning now from the demand from that meeting, another meeting with public health on the vaccinations issue so that we can continue. And I know many people are doing this, and there's some excellent webinars and events that lots of people are doing that will happen and are happening all the time. We all need to do as much as possible. There are other sounding boards, and I'll let Charles leads on one of those. I'll let him speak about that. And basically, we are constantly there to receive information from public health and other channels that we have connected with, so that we are disseminating all the time the messages out there to all the communities we're in connection with, the networks we're in connection with, and working at pace to do that. And within that, making sure that we've got the languages and cultures and the appropriate messaging covered. We have set up through BME Network a web page around COVID in our communities, and we post lots of resources and information there as well. So lots of avenues there for you to that. So that's a very quick, apologies if I've taken longer than I should have, but very quick points on what we're doing.
Thank you very much for that, Atia. That's really great to hear. All that good stuff that's going on. You've clearly been very busy individually and as a network. Kush, can I invite you now to just tell us a little bit about what Europia's been doing?
Yeah, thank you, Stuart. Hi, everybody. Thank you, David, for that really informative information about the surge testing which is going on. In fact, a couple of our team members are part of the test kit handout service today. We got a message from the health development worker yesterday, and we found 2 of our staff members who have cars who can go and help them give out the testing kits. Last week, we did get a request from the health team to see if there were any Polish speakers who would go to do door-to-door testing. We spoke to a couple of our volunteers, and it didn't really go anywhere. The reason for that is because EU nationals have been completely forgotten in COVID messaging, be it from central government, local government, or anywhere else. Last year, we have had to lobby, talk to different MPs, councillors, and try to find messages which can be translated into EU languages. So we started partnering up with an organization called Doctors of the World, and we started doing some of the translations for their EU language materials. They have done 8 versions so far, and we have been part of all of them. We have also partnered up with a national organization called Maternity Action to do translation of their extremely useful resources on the rights of pregnant women. As an organization, our demand has absolutely exploded. I think the cracks have started to show in the systems that EU nationals, because they're white, they're Europeans, they're Christians, they're often invisible, and people don't see them at all. So a lot of services were not able to support the client group because they just didn't know the client group existed in their catchment area. And I think it sort of showed very starkly how there were absolutely no services at all for the Roma Gypsy community. So other organizations have been doing some work for the Roma Gypsy community in the past, but it was completely academic, research-oriented work. Again, grants came to an end, things came to an end, and the Roma Gypsy community have been completely left high and dry. So we must definitely praise the health development team from Longsight, Gorton, and Levenshulme. We are working extremely closely with them on the flu campaign, and now we are talking about health checkups, vaccination, and lots of other issues. I think something that we're quite proud of what we set up is a small fund called Europia Emergency Fund. I'm going to try and paste it in the chat box over here. It's an extremely simple application form. We give between 30 to 60 pounds. It's very, very light touch. It's in different languages as well. But anybody can complete the application form for their neighbor, friend, colleague, anybody. We normally make payments twice a month. Again, so far we have given out just over £5,000. And the reason why the number seems low is because EU nationals don't like accepting help and support. Contrary to what the media says, that they steal jobs and they take benefits and they do all of these horrible things. They don't like taking help and support. They're extremely self-sufficient and they're very proud individuals and community members as well. Also during these difficult times, the immigration support has completely stopped. Some of you may know that EU nationals required to have something called as the EU settlement scheme. So last October, the funding ended from the Home Office, and there isn't a single organization in Greater Manchester that's got funding to do the EU settlement scheme. So we have partnered up with the London Mayor's Office, and we have started doing the EU settlement scheme stats. So we have done it twice so far. And it's really, really surprising. Oldham has one of the largest number of application rejections in the entire country. And also compared to London, where very few non-EU nationals were applying for the EU settlement scheme, in Greater Manchester area, more of non-EU nationals, which is their family members from other countries and ethnicities, were applying for the EU settlement scheme compared to EU nationals themselves. So I think there's a real strong need to recognize and understand that EU nationals are there and they are facing lots of different challenges. Coming back to the topic of COVID-19, we have got a small pot of funding from Barrow Cadbury Trust, and we're doing surveys to understand the attitudes of EU nationals. So we have done another survey in the past, but this is slightly more geared up to do with the vaccination and test and trace app. I've just put some of the details on the chat box. Please do share it. If you are EU national yourself, please complete it yourself. We are working with different community groups and organizations, consulates and high commissions to make sure we capture as much information as possible. There is a constant frustration with EU nationals that the messaging that they get from this country is quite starkly different to their home countries in Central and Eastern European countries. So it's a constant conflict of what messages should they follow, and the translated materials that come from UK sources are really quite bad. They've been done by academia individuals who use the posh language that's not used by day-to-day people, and people don't understand what they're talking about. So there is a definite disconnect in messaging going to EU nationals. But when there is some messaging going, it's in a format that's not accessible to them. So for example, the Roma Gypsy community, one research says that only 25% of the Roma Gypsy community living in Greater Manchester have accessed high school education. So they are largely struggling with literacy. So posters and leaflets, no matter how many you do, it's not going to work for them. They need to hear it from somebody through a voice or a video format, and always somebody who they trust and they know. So we are doing lots of work with the Roma community. We are setting up a Roma women's group at the Roby Church, again, alongside. We have just started the tele-befriending project specifically for the Roma Gypsy community. And we are looking into some of the challenges they face during bereavement within the community. We are working with national organizations to try and promote the census, because not just EU nationals, specifically the Roma community who have multiple families living living in, they sort of hesitate to complete the census forms, again, because they don't complete it, they're not recorded. And then the local government says, where are the EU nationals you're talking about? You don't need any funding for them because they don't exist, but they do exist, they just don't complete the census forms. So I can talk forever. I'll just say thank you for this time.
Gosh, that's really good. Thanks very much for filling us in there on the work of Europia. And finally, Charles, if you'd like to just let us know a little bit about Caribbean and African Health.
Great. Thanks for organizing, Stuart, and the team, and great to see many known faces. So I know many of you have questions for David, so I will be really, really brief. But I've put our website link, in the chat box. And as Atia mentioned earlier on, CAHN is a member of the Greater Manchester BME Network, and proud to CAHN being set up. I have been a part of that for many, many years. So I'm the Chief Officer for the Caribbean and African Health Network. We work right across Greater Manchester, working with partners to reach our Caribbean and African community. And we also, in the light of the pandemic, we've been doing a lot around messaging. Since the 2nd of May, we've been holding weekly health hour sessions. So Saturday morning between 11 to 12, usually goes on until 12:30, where we get Black GPs consultants who engage with the community. On the back of that, we've held several events. Atia has already mentioned, we're part of the COVID Health Equity Manchester group, and we facilitate and host the sounding board for the Caribbean and African community. And what we've been trying to do is make sure we can help break down the messaging for, our community. On the back of that, we've set up a helpline that has been going for, since the start of the pandemic, and, people could bring that, all things COVID and non-COVID related. We have a Black-led, mental health counseling service. We've started a family service. But as David mentioned, because we're trying to support the system to reach our community, whenever there are any issues, we will go along to meetings, we would ask, what are the key messages they want us to take back to the community. Equally, we feedback concerns from our community so that will inform, the messaging and the comms that our health partners will, push out to the community, because I'm sure many of you agree some of the stuff at national level sometimes doesn't really speak to our communities. So for our sounding board, for example, when we've had Elaine Jackie present local Manchester data, number of people either contracting COVID, ending up in ICU, the fatalities, it makes a lot more sense and it empowers people to go out there and communicate the messaging. So we've been doing lots of partnership work, and we still, continue to do that. The thing I'll end with is with the surge testing. Our message had been very clear to the community that the surge testing, is in light of the new variant and has nothing to do to lure our community, to get the COVID-19 vaccine. So we've been trying to keep those messages separate, because even those who've had the vaccine still need to have the test, because we're looking for the variant, and we want to make sure we have good intelligence about what is happening locally. So those are the messages we've been pushing. I've had the vaccine, the first jab myself. I've done a short video, I've sent it out, to partners, and just really encouraging people. So we're still saying to our community, if you have any concerns about the vaccine, the helpline is there. If you need a GP or a Black, medical consultant to speak to, for some reassurance, that is available. We've had, some big sessions. Tomorrow morning, we're going to have another session on the vaccine, and we just look forward to working with the system and to support the messaging. So I'll leave it over there, but our, website is in the chat box, and, happy to share further information.
Great, that's brilliant. Thanks very much, Charles. And thanks to all the speakers. I know there's been a lot of good links put into the chat box. So what we'll do, we'll make sure that those links get forwarded to everybody that's taken part in the session today. Right, I think if we have still got plenty of time, so if there've been some questions, Charlotte and Millie, have we got some things coming through on the chat for David or anybody else?
Yeah, thanks, Stuart, and thanks, everyone. We've got a couple of questions from a bit earlier on for David here. So, David, if someone lives just outside the boundary in the designated areas, are they allowed to go and get tested?
So if people work in the area. So if they work in any of the shops or businesses, then they can get tested if they work in the area. But if they live outside the area, we're asking people to use other testing sites. So if people live outside the area, if they're symptomatic, they should use some of our other testing sites. So in that area, there's a Denmark Road testing site, there's Birchall Way, PCR testing sites for people who are symptomatic. We do have an LFD testing site. As I say, we had to convert Moss Side Leisure Centre, but we do have an LFD testing site at Manchester Rates Hall, the Town Hall extension, and we have a booking service for that. So people can still get tested outside the zone through the normal routes, but really we want to keep because we've had to submit postcodes centrally for the genomic sequencing, it's important we stick with that. To be honest, we're not going to, if people do say, well, I know I work here, we definitely want to, everyone who works in the area, definitely there's no barriers, but we do have to draw the boundaries as you know, for these things, but there are other testing facilities.
Okay, thank you.
Thank you, David.
Another question that's come through, how does the collection of samples for full genomic sequencing differ from PCR test or LFT?
Yeah, it's quite a simple one, that one. For LFTs, there is no genomic sequencing. There just isn't the technology to use those samples for genomic sequencing. So the only genomic sequencing that can be done relates to PCR tests. And for people who get PCR tests through the normal route, if they're symptomatic, that's where the random samples are taken to look at identifying those. And then through this exercise, that's why we're using PCR tests, because unfortunately we can't do the sequencing on the simpler, easier to use 30-minute LFD test.
Okay, thank you. Just another one for David quickly. So once a swab and a negative result has been received, do residents get retested or use home testing over time, and if the variant remains?
So yeah, so in terms of, and Charles will know some of this, there were plans to have community testing sites across the city before lockdown to have opportunities for people to access lateral flow device kits. Now, we'll be obviously looking now as we see what the Prime Minister says on Monday about the roadmap out. We do have LFD testing sites for key workers, not just public sector workers, all key workers, shop workers, transport workers, people who have to go out to work. So we have at FC United in the Moston area. We will have Moss Side Leisure Centre back as an LFD testing site. The Rates Hall, we've got Debdale Park, and we've got Heathfields, and I've forgotten the one in Bagley, sorry, but we've got the LFD testing sites that, and we'll probably be mobilising more sites post-lockdown, and we're in discussions with Charles and CAHN as well about a national pilot there. So we will be having more testing sites. In terms of the variant, so depending on the results of this exercise in both Moston, Harper Hay and Moss Side and Hume, we'll be looking obviously how many cases we find, but it won't change the actual testing approach. So I think what we'll be saying to people is, if they're symptomatic, irrespective of the variant, always seek a PCR test, ring 119, book on the portal. That messaging will not change, variant or no variants. And then what we'll see post-lockdown is more LFD testing sites for people to be able to access testing. You'll know about the schools. There's going to be an LFD testing program for schools, for colleges, the university students. So we will see more and more testing as part of our post-lockdown approach, and we'll have more facilities. There'll be more employers. Any employer with people over staff, more than 50 staff, can access the government scheme as well to use LFD tests. So we'll see more testing be deployed across different sites and involving yourselves in the sector as well. So plenty to plan for as we come out of lockdown slowly. So we know schools will be the first to go back, and then there'll be a sector based approach from spring onwards. So, but yeah, testing will be very much part of our day-to-day lives going forward.
Thank you. We've got a question here, and I'm not actually sure who's necessarily going to be able to answer it. How many BAME volunteers are actively involved on the ground in supporting the take-up of the vaccines in all areas across Greater Manchester? Or where can they find that data?
Want to repeat that, Millie? Sorry, it was yeah.
Sure. How many BAME volunteers are actively involved on the ground in supporting the take-up of the vaccines across the entire of Greater Manchester?
So I wouldn't know for Greater Manchester, but we would through Val Bailey Bridew at Manchester Health and Care Commissioning. I'm sure have the data at the Manchester volunteer base. So the volunteers are being used across our 8 vaccination centres in the city, and also our pharmacy schemes. And I know some of our local elected councillors from our BAME communities are volunteers as well. But actually Val Bailey Bridew would have the breakdown. And I know that part of the point of the question, we need to increase the diversity of the volunteer base as well. We need to draw on what Kush was saying. We need to draw on volunteers from all the different communities in the city, so that when people go to a vaccination centre, they feel it's for them. But Val Bailey Bridew's done I think it's the number of volunteers, the volunteer response has been fantastic. But Val Bailey Bridew would have the information for Manchester, and there'll be the equivalent of Val, I'm sure, in the other 9 local authority areas. But Val will definitely have the information for Manchester.
Thank you. I hope that answers your question. There's nothing else here coming through the chat. Stuart, did you want us to?
If you don't mind, can I come in on that point, please? There may be lots of fantastic BME volunteers, but the community members themselves are not sure, and they're not getting any information. Again, they're having lots of challenges believing that the vaccination is safe and real. It's not just BME community members, lots of other people as well. So I think irrespective of having good number of volunteers, there needs to be more done to communicate to the general have to get the vaccination. And I think the first step definitely has been the multi-celebrity video that's just come out today promoting the vaccination, which is a fantastic first step. I think locally that can be duplicated.
Could I, sorry, I was the one who raised the question. My name is Zainal Sashak. I actually work for the Islamic Society of Britain. And we've been recruiting BME volunteers across Trafford, and we're rolling, I posted it in the chat, rolling out a call for more BME volunteers, because we're just echoing what the gentleman said earlier. There is a bit of lack of credibility around having not representative peoples at these clinics. So we've been lobbying the public health people, because it's all well and good having 1,000 volunteers, but they're, as you rightly point out, not very diverse. And within our pool of volunteers, we've got a lot of medics, Asian medics, who are very keen to get involved. But we're coming up across certain barriers within the establishment to take us on board, because we're not really part of the what called mainstream volunteer route. So we're actually forging links with specific clinics, but we're also about to launch a group of what we call COVID warriors, which are going to be specially trained to go out into their local communities and actually basically put the correct facts about the vaccine and ensuring that people from those minority communities who don't necessarily access social media and so on, because we make a big assumption here that everyone in these communities will use things like, Zoom webinars or such. But in some areas, as we very well know, they're very, very closed. They're mistrustful of the authorities, and the anti-vaxxers are really working overtime to stop folks going on. I mean, I had a lady who said a senior member of their family had said they shouldn't take the vaccine. So as a result, 25 of them in that family are not going to take the vaccine. So we really got a tough challenge out there. And there's been a lot of work around communication, and what I would echo some of the points made here, that you have to have credible voices which the community will trust. And sadly, a lot of the communication that comes out from both nationally and at local level doesn't translate well into some of those communities. And that's largely due to lack of understanding of the cultural nuances with language. Putting a translation of an English narrative out there just does not work. And also the channels that they use, like WhatsApp, and in some areas they have their two-way radios or receivers with the local imams. And there are lots of local gatekeepers as well to communities, which people need to be aware of. So I'll get off my hobby horse, but say we need more volunteers. And I'm hoping to speak to Charles a bit later today, but we're working with a number of local organizations in Manchester to try and get them collectively to work together. Because at the moment, there's an element of each organization doing their bit.
That's great. Zano, sorry, I'm cut off there. If you can leave your contact details, or if you're happy for us to circulate your contact details,
yeah,
so that there are organizations.
Yeah, I don't know, I can't post it, but we've got posters as well, which we've been circulating through a whole range of channels. And I'm not apologizing for what I say, and sometimes make myself unpopular with certain elements of the authorities, but I think they're sometimes quite blind and not very diverse at the very senior level.
Yeah.
I'll leave that.
Great. I think that there's a good points that you've made, and say if you leave your, well, we've got your, I think, do you put your organisation's contact details in the chat, so we can certainly circulate that around and make sure that gets promoted round to, I know David was interested to have those, and round to everybody else. It's messaging that needs to get out there, and need to be, as you say, combating the negative publicity, the negative messages, and getting the right messages out in as many different ways as we can. I'm aware that we're nearly at time. Were there any other last questions, Charlotte, Millie, anything else come in the chat that we want to put to David or anybody else?
No further questions in the chat at this stage. I think just if anyone has anything, please feel free to follow up with any of the speakers who've shared their emails in the chat, or with us at Macc directly.
Yeah, that's good. So it just leaves me to kind of formally thank David, Atia, Charles, and Kush on behalf of everybody here, to thank you for giving up your time. Thank you for sharing with us the work that you've been doing. It's, I guess, incumbent upon all of us to make sure that the positive messaging keeps getting out there to the communities, that the people that we're working with pick up the right messages, and we're telling them how to access the right information and what to do for the best in terms of vaccination, in terms of testing, and in terms of good COVID behaviours generally. I think, and it's just a good question to just keep channels open between ourselves as well. I think today's a great example of, if you want to call it co-production, cooperation, partnership, whatever you want to call it, between the voluntary sector organisations and between us and public health and between the council. So one thing I think that a crisis does, it brings people together, and it starts to emphasise the good things that are going on and that can go on in society. So I think what we need to do is incumbent upon us, and essential that we keep pushing those positive messages. Keep working. We can't do much, but collectively we can do so much more. So yeah, so thank you again, everybody who's spoken, for your time. Thank you for the questions and the information that's come into the chat. We will share that as much as we can We're going to make this copy of this webinar available on our website. As I said, we are recording, although I missed a couple of sentences at the beginning because I was late in actually pressing the record button. So apologies if a few words of wisdom were missed off at the beginning. But 99% of the webinar will be available on our webinar. So if anybody from your organization or your communities wasn't able to make it today but wants to pick up on what's been said, then we'll share a link out to everybody for that as well. So thank you very much for your attendance today. Have a lovely rest of the day and good weekend. Stay safe and see you all soon.
Thanks,
Bye.
everyone. Bye. Stuart, I've got the recording from before you said it, so we've got it all.
Oh, brilliant. You started recording.
Yeah, after I posted in the chat.
Fantastic.
Charlotte, are you able to download
Thanks for that.
chat?
Yeah, I've got it already.
Great, thank you.
Wow.
So I'm going to stop